Where there's a will, there's a way.
Thanks everyone for coming. It's an awesome turnout. I think it's the biggest one of these talks that I've done. So yeah, credit to NW Fitness for advertising it all and getting you guys here, really. So I'm going to talk for about sort of 45 minutes-ish. If there's any questions as we go along, please just jump in, put your hands up. It's about you guys, so it's obviously about back pain and sciatica. So we want to keep it as relevant to you guys as we possibly can. So do just jump in. We can answer as many questions as you want as we go forward. So if we go off on a tangent away from the stuff I've got, it's absolutely fine. So I'm Will Moore. So I own Moore Performance. So I was born and bred in St Ives. I've always been a keen rugby player. So I played rugby for St Ives and then for Shelford and then for Northampton Saints. Before everything fell off and I broke myself, got all sorts of aches, pains, injuries, some of which are back problems, so I know where all of this is coming from. So then I decided to go and study this to help people. I thought it was really interesting, all the people that I kind of saw for my issues, so I thought let's go and train to do this. So I went and trained over in Gloucester. After I finished, I went to work in professional rugby for about 6 years. So I worked in both rugby union and rugby league for Gloucester, for London Broncos, done a bit of Bristol and a few other bits. And then in 2017, I started Moore Performance. So coming up to 10 years next year, which is quite exciting. Which I only realised when I did one of these talks about 2 months ago that I realised it was coming up to 10 years. So yeah, really excited about that. And I also published a book in 2024 called The Weekend Warrior. So that's a #1 bestseller on Amazon, which I'm incredibly proud of as well, which is really awesome. And at Moore Performance, we help hundreds and hundreds of people with back pain over the years. So it's a real kind of staple of our business. It's probably the thing that we've seen the most over the years. So I thought back pain's a good place to start for our first seminar here. So at Moore Performance, so our mission at Moore Performance is to give people the healthcare that they deserve. So we've obviously got our NHS system and we know it's an absolutely fantastic thing. We're really lucky to have the NHS. But we know for things like this, things that we're going to talk about today, it's not the best at the moment, and the delays and the kind of access isn't quite there. So what Moore Performance is, it gives people the access to the care that they need in a very timely manner. And it also gives the right care for the right person. So everything's nice and individual, so nothing is the same. No one will walk out with the same treatment plan, rehab plan, the same conversation. So we're very individualised to what's going on with everyone. And we're not dictated by kind of tick boxes and pathways. So we've got certain processes we use to get to the places we want to, but we don't follow any particular pattern or pathways. We go to whatever you guys need. So we've got 3 clinics. So our main one is in St Ives, so it's on the industrial estate in St Ives. So if anyone has been there, will know it's round the corner from Screwfix, so about 5 minutes from here. Our second clinic is in Alconbury Weald, and then our third one is in Bayborough in Cambridge. So I presume a few people here have got back pain or have got an interest in back pain. Does anyone want to put their hands up and just tell me a little bit about why they wanted to listen to a talk on back pain? Do you want to go first?
Well, I am currently experiencing back pain, and it's really frustrating because I want to be able to train at the same time, but I don't know when I'm doing myself, like when I'm doing damage or when I'm doing things that are actually beneficial in the long run.
Yeah.
And it's really hard to figure out the line.
Fantastic. Yeah, some perfect stuff in there. Perfect. Anyone else? Want to?
I've got a disc, the bulging disc, which is causing extreme nerve pain right down my leg at the moment. Yes.
Perfect. Anyone else? Everyone else got nice healthy backs and no pain?
I injured my back falling down some steps from a height several years ago, and I think I've always had a weakness in the back. And now when I'm coming to the gym, I'm frequently getting pains in the back, and I just want to find out how I can best manage that.
Fantastic, perfect. Yeah, so you can tell by those kind of three things they're very different stories, but they're still back pain. I think everyone is. The stats keep changing, but I think most people are going to experience back pain of some sort in their lives. It used to be 50% of us would get back pain, but there's not many people that are over 30 that haven't already had back pain. So getting kind of more miles in the clock is going to just get more and more kind of aches and pains. So what we'll talk about is a few different types of back pain, and then we can go through some bits that will help it. So first, I'm going to do a real quick whistle stop tour, something like that. Your back. The back is probably one of the most complex kind of areas of the body because it is made up of so many different bits. So this is a real whistle stop tour of what your back is made of. So we'll start with your vertebrae. So your vertebrae are the bones. So they're all the kind of bone, beige coloured things on this model. They're quite obvious, they're the bones, we call them vertebrae. You've got lots of them all the way down from your neck to your tailbone. The next bit is the bits in between, so they're the discs. So everyone's probably heard of the discs, everyone's heard of disc bulges, everyone's heard of herniated discs and bulging discs and all the shenanigans that probably most people don't really know what they mean. They've just heard what terms are, and know that they don't sound very good. So what the discs do is they're the shock absorber. So they're like the suspension in your car. They sit between each vertebrae and they allow us to absorb force, but they also allow us to move. If all of these vertebrae were just one long bone, we wouldn't have any movement. So they allow us to move, they allow us to bend, they allow us to twist and hinge. They also protect our nerves where they come out. So their discs have got quite an important job. The next is the pelvis. So I class this as lower back. Lower back is a kind of term for an area of our body, not actually an actual anatomical term for anything particular. It's just all of this area is kind of classed as your back. So lots of problems that people think is their kind of spine itself is actually related to their pelvis. So I link this into it. So we all know our pelvis, big bones, are kind of our hip bones, if you like. And then the last thing is the muscles. So obviously we can't see our backs. Our back doesn't look like this. It's surrounded by lots of other bits. So it's surrounded by a big sheet of muscles. There are hundreds of muscles in our body. They all go in various different directions. And there's loads of very complicated ones in our back. So we need to make sure that they're all working properly and we know what they do. There's loads of other different tissues in there. We've got nerves and we've got kind of fascias and joint captures and all that rubbish. So there's loads of other bits, but that's the main bits that you've probably heard of. If there's any detail people want me to go into in any of that, then just let me know. But that is the main kind of.
What are the discs made of? Is it cartilage or?
It's kind of their own structure, so it is a form of cartilage, but there isn't anywhere else in the body that's got it similar. So the closest would be the cartilage in your knee, so your meniscus, but they are a kind of almost like a thick jelly substance. But what makes them different is that they have a nucleus in the middle, so they're like a balloon with something in. Well, a jam donut is what we use to kind of explain them in the clinic. They've got a nucleus inside, so when they get split, so when the outer layer of the donut splits and it gets what we call herniated, that nucleus comes out and that's what goes into the spinal canal, and that's when kind of bad things happen, we get some nasty stuff. But they're almost kind of the substance that you see on these sort of models. They are when you actually, the likelihood you feel is probably quite slim, but in reality they do feel like that kind of jelly-like substance. They're a lot more solid than you think because they do take a lot of pressure. Not only do they take pressure of when we move, but over the years, every time we're stood up, we've got the force of gravity. So we've got kind of, I think it's 10 kilos worth of gravity or something like that, pushing down on our heads every single day. So they've got to be able to cope with that. That's why we lose some of our height as we get older, is that gravity does compress them. But yeah, most of them jelly. Any other questions on the kind of anatomy? Cool. So, what causes back pain? So again, these are just a few bits that can cause it. And if there's any ones that you want me to expand on, then we can. The first thing that we all know is sitting all day. So sitting for long periods, life over kind of years and years has developed to involve more sitting in cars, at home watching the telly, in seminars, listening to me talk rubbish. And various other bits is involved sitting, and anatomically we're not really designed to sit. It crunches everything up and puts us into a strange position. Sitting in bad posture is even worse, so we're not designed to sit in good posture, so as soon as we then go into sit into bad posture, it compounds it. A lot of the bits that we do force us to sit in bad postures, so things like sitting at desks on computers, sitting at desks reading books, sitting in bed reading books, on our phones, things like that puts into these kind of hunched over postures, which isn't good at all. So the first thing that causes it is just years and years of sitting. So I've definitely had a few change their postures, as I mentioned, sitting postures. This normally happens. It's not something that we need to be scared of because it is life, but we just need to be aware of it and that we do something about it if it gets too far. So the second thing is inappropriate exercise. So we're not just talking about gym, we're talking about exercises, anything that you'll load in the body. Your body doesn't know whether you're picking up a can of beans from a cupboard or you're picking a dumbbell off a rack. So anything that involves movement we class as exercise. Kids, grandkids are a really good example. When you're in here with Bradley and he's telling you to grab a sandbag, we all lift from the knees, lift properly, remember all you've been taught. When a little toddler's running around, that all goes out the window and you go and pick and lift them up very percent. Your body doesn't know the difference, it just knows there's load through it. So inappropriate kind of exercise and lifting techniques are a really, really big one. And that can happen at any time. It can happen in the gym, it can happen at home, it can happen at work. It's not something that you need to be scared of, and we're not saying that you've got to lift everything in a great posture. What we need to be able to do is be robust to be able to cope with those slightly off postures. And obviously you guys are mitigating the stuff in the gym because you guys have got great technique from all the coaches. We talk about it all the time. When everyone's in the clinic, of their philosophy is really linked. That's why we kind of got a great link, because our philosophy is blind. You're not just going to lift ridiculously heavy for the sake of it. You're going to lift as heavy as your posture and your technique for that. So we can mitigate that, but we've got to take that into everyday life as well as in the gym. So the other thing that you might not have thought of is postural changes. So as I mentioned with gravity, as we get older, we're kind of subjected to a lot of different stresses, some of which are gravity, some of which are life, and this will change our posture. So some postural changes are just natural, they come from gravity, some come from repetitive work, so either sat at keyboards or certain manual jobs, lifting, kind of anyone that has had kids, through the years, lifting kids is going to change your posture. So that's also something that we've got to be aware of that can cause back problems. We also, the kind of fairly obvious things of traumatic problems. So if someone's been in a car crash, if someone's kind of been knocked into, if someone's had something dropped on them, those sort of things are relatively obvious to cause back pain. Sure. So the kind of common causes of general back pain. So those are the overall the causes, if you like, but these are a little bit more going into diagnosis. So the first one is SIJ dysfunction. So does anyone know what SIJ is? Perfect. Any idea where?
Sorry?
Any idea where it is on our
You want to
spine?
It's down here somewhere. I'd have to count. It's down here somewhere.
Yeah, so it's it's here. It's here. So this is our sacroiliac joint. So this is going back to where I spoke about pelvis being part of our lower back. This is where our pelvis attaches to our spine. It's where our sacrum attaches to our ilium. Nice fancy Latin terms, but it's where the hip bones attach to your spine. And what happens every time you move or bend over, these should move slightly to allow us to bend down and not have a horrible curve in our spine. So a big kind of common issue is when we get what we call dysfunction. And dysfunction is when something doesn't work properly. So what happens is one of two things. One is it moves too much. So if there's hypermobility within that joint and in that area, we get problems and it just moves too much. And if things move too much, things stretch, things can get torn, things can get overused. The other more common thing is when it gets too stiff and too tight. So either from a traumatic injury or from poor posture, we can get a real bad stiffness around these two joints, and what that is called is dysfunction. SIJ dysfunction. So sacroiliac joint dysfunction, and that's when everything stiffens up and it basically freezes together. What that causes is it causes the force to go somewhere else. So if the force can't go through this bit, it then suddenly goes either up or down. Most of the time it goes up because that's the easiest place for it to go. And that's when we get overuse in our vertebrae, in our discs, in our muscles around that lower back. But it all comes from that SIJ dysfunction. So that's the first one that you might not have heard of. The next one is sciatica. Hands up if you've not heard of sciatica. Anyone know what sciatica actually is? It is very painful, absolutely. Yeah, exactly. So the sciatic nerve is one of the biggest nerves in the body. So if you ever see a sciatic nerve, it's about the thickness of a thumb. So it is incredibly thick. Normal nerves are about the thickness of hairs, and some of them are even smaller. Some of the ones that go into our skin and obviously into our eyes, microscopically you can't see them unless you've got some very clever kit. Whereas a sciatic nerve is about the size of your thumb. In some people it will be a little bit thicker, but it's incredibly thick. So sciatica is where that nerve is being pinched.
It hurts then.
Absolutely, exactly, yeah. You're pinching the kind of the lifeline to your lower legs, and it's such a big nerve. We know what it's like when we irritate your skin. If you get a little graze in the nerves and your skin are irritated of how annoying it is, and they're microscopically tiny, let alone when you kind of irritate something that's the size of your thumb. It's the size of your thumb because of a good reason, because it supplies our legs. Our legs need to be powerful to run, to move, to kind of look after ourselves really. So sciatica isn't the only kind of nerve pain that you can get, but it's most common, and it's when that sciatic nerve is pinched. And that can be pinched at a few places. So it can be pinched where the sciatic nerve comes out of our spine. So some of these yellow things here are nerves. Where these come out, they can join together, and that's what starts off our sciatic nerve. So it's like a kind of spindle. If you've ever seen a spindle of wool that kind of winds together, that's kind of how our sciatic nerve starts. It starts with individual nerves that then comes through our pelvis, and that's when it's all attached together to create sciatic nerve. So it can be irritated or pinched further up in our spine. It also can be irritated in our pelvis. So it goes through a couple of muscles, and it goes very close to another couple of muscles. So if it goes through one of them and that muscle is tight, it can pinch on it. Also, if the muscles around it that it goes next to are tight and irritated, it can also pinch that and cause problems. True sciatica is when we have nerve symptoms that go down that sciatic nerve. So that sciatic nerve, as I mentioned, attaches to everything in our legs, in the back of our legs. So the more it's pinched, the more it will affect. So it can start with kind of just a little bit of an ache down your leg, and then it can go into shooting pains, it can then go into numbness, and then it can if it's really nasty, stop kind of everything like working. So it's got its important job. There are other nerves that can happen. Obviously each one of these little kind of nerves has got a different name. The sciatic nerve also splits and has some roots off of it that have different names. So just because you've got nerve pain down your leg doesn't mean it's sciatica. So we do get quite a lot of people in clinic that come in and they've got pain down their leg, or they've got shootings kind of stuff down the back, and they think it's sciatica, whereas actually it's not. It's, in reality, it doesn't really matter, but it's not always sciatica if it's going down. Does that make sense? Any quick questions about the sciatic nerve or sciatica? Cool. So the next one is muscular back pain. So this is probably the most common thing that we see is muscular lower back pain. It's also probably the most common that most people have at some point. Muscular lower back pain is kind of what it says in the tin. It's just a problem with the muscles that are surrounding your back. They can happen from a few reasons. So the most common one is when the muscles go into a muscle spasm. So when they go into that, effectively a cramp, when they're trying to protect it. This is normally when you put yourself into a strange position. So it's not normally when you're under lots of load. It's normally when you're kind of twisted to pick something off the floor, you've dropped your car keys and you're in a rush and suddenly you bend down and then it goes into a muscle spasm to protect itself. In reality, when you get a muscle spasm, you're not in any danger. There's no damage whatsoever. All that your body is doing doing what it should do. It's protecting itself from further damage. So in reality, a muscle spasm it doesn't feel like it at the time, because sometimes it can feel like you've been shot in the back. It's pretty horrible, but it's doing its job. It's stopping you getting any of these other nasty pathologies. What our body isn't great at is coming out of those muscle spasms. So if anyone has had a muscle spasm, especially in their back, it is pretty horrible, and it's done its job, and then it just stays like it can stay like it for quite a long time. So in reality, there's no damage to it, but it's still pretty painful. The problem we get with muscular lower back pain is once our body has done it once, it goes, cool, we've done our job, pat on the back, next time you do it, let's do it again. And it just keeps going round in that cycle. So suddenly it's kind of quite a big twist or mechanism or route to set it off. And then next time it goes, oh, you were quite close to that similar mechanism. Last time we set it into spasm, let's do that again. And it keeps happening at lower thresholds. And then before you know it, when you put your arm in your pocket or you're bending down to put your socks on, then it can go into a muscle spasm. So even though it's one of the kind of easiest ones to fix and one of the least problematic, it's one of the most annoying and one of the most reoccurring things. With all of those, you can have a combination with all of those. So that is a very kind of Fisher-Price basic description of all of those. I've been on kind of 2-week-long courses just on sciatica. So to describe it in sort of 5 minutes is quite a whistle-stop tour. So if any of those want more depth on there, there's loads more depth.
With the muscle spasm, are you best when you have it? Are you best to just rest it and leave it, or are you best to move and just try and get you out of spasm? Are you best to move and manipulate it, or lay back and just let it run its course?
Absolutely move. Move is so key. So key. When it's, as long as you've kind of, you know it's nothing nasty. So if there's not a big mechanism, then most of the time you can safely say it's a muscle spasm. The worst possible thing you can do with a muscle spasm is nothing. If you go and do what we're used to told, of lie on a board and wait it out, it will just be horrible. Because it will feel nice when you're kind of laying still, but all that is happening is it's just stiffening up and stiffening up. If you think of it like blue tack, if we kind of leave blue tack out in the cold and then we try and manipulate it, it's just going to be brittle, stiff, horrible. And that's kind of what happens with our back if we just leave it when we have a muscle spasm. So what we want to do is move it as quickly as we can. You've got to be careful when you do it, because if you move it too quickly, as in kind of velocity quickly, then you're just going to set off another muscle spasm because our body gets scared. So what we're looking to do is lots of gentle very slow movements. And it doesn't matter if you can only move kind of very slightly. So if we were in a muscle spasm, all I could do was that, of sort of rocking, then that's better than nothing. And then as the more you do it, the more it will start to move. But I always tell people to think of it as blue tack. So you start manipulating it really kind of gently, and the more we start to get it moving, the more pliable it is, and before you know it, it starts to get moving. But yeah, muscle spasm, the worst thing you can do is sit and do nothing. Does that make sense? Perfect. And then the last one that I was going to talk about, I've kind of already touched upon it, is age-related disc changes. So disc changes are completely natural. Everyone gets worried about discs. They are an important thing, but our body naturally over the years is designed to reduce the size of those discs. It isn't a problem, it's not an issue, it just happens. Doesn't mean that you have to do anything differently, doesn't mean there's anything wrong, it just happens. So if we did an MRI of everyone in this room, everyone that doesn't have back pain, most people will have a disc issue. I can't remember the stats, but I think it's something like 70% of people over 40 that have no back pain whatsoever, if we scanned them, it would show up with a disc bulge or protrusion on an MRI scan. So if that's the case of people that are completely pain-free, doesn't mean that there's always a problem. So it's a big bugbear of mine of kind of imaging of lower backs without any context, because it just doesn't show us anything. It's helpful if we've got clinical context, but if we've not got any clinical context of sort of what we're looking at, then it is absolutely pointless, because everyone in this room will show changes of a disc issue. I've got an MRI on my back from when I played rugby at 18, and it showed 3 disc bulges. I have a 0 back pain. I can lift heavy in the gym. It doesn't cause me any problems. I could run if I enjoy it. But it doesn't stop me. I can do whatever I want. But if we just went on that MRI, I'd be chopped up and have a fused spine. So it is really important that we understand that these kind of age-related changes are just normal, and that's the same with any joint. If we x-rayed any joint or we MRI'd any joint, there's going to be wear and tear in it, and that's just how our body works. Doesn't mean there's anything wrong. That's how our body works. So context is key with anything. Does that make sense? Right. That's good. Right, so how do we know we've got each of those things? So SIJ dysfunction, some of the common things if we've got that is difficulty putting our socks on. So if we're sat down and we can't reach forward to put socks on, if we're stiff getting out of bed in the morning, if we're sitting or standing for long periods of time, we get a toothache, dull pain in our lower back. So this is a real kind of the common causes or the common symptoms, if you like, of SIJ dysfunction. So the common symptoms of sciatica, I think we've already covered that, but it's pain down the back of your leg and pins and needles or kind of certain neural symptoms that are going down the back of your leg or into your feet. Everyone will describe anything wrong with nerves slightly differently. So just because you've got kind of, it feels like ants rolling down the back of your leg, or it feels like it's cold, doesn't mean it's not sciatica, it just means you're feeling it differently. We're told pins and needles, but in reality, everyone has a different way of describing pains, and some people can find it really hard. If you've not had a huge amount of pains over your life and you haven't had these kind of things put in your head of what it should feel like, it's quite hard to describe it. So with any of these, it is very subjective of what it feels like for you. Some people feel cold, some people feel pins and needles, burnings. All of these sort of things are indicative of sciatica. So muscular. So muscular back pain feels almost like you're wearing a kind of corset. So if anyone's ever sort of worn one of them back braces around themselves, that's what muscular back pain feels like. It feels like everything of a broad spread around their back is tight and is aching. Sometimes it can even come around the front, and it can come sort of around the sides into your hips, into your glutes. Normally, again, that's stiff when you're trying to get up out of bed, when you've been sat still or laying still for a long period of time. It will feel like that stiff, achy, tight kind of pain. It will also start to ache towards the end of the day or when you've done a lot of work. So muscles that stay tight, you're using a lot of energy. If you imagine trying to hold a wall sit for 24 hours, that's going to burn quite a lot of energy. And in reality, when our backs are in spasm, that's what it's trying to do. It's trying to hold that muscle contraction for a long period of time. So that's why towards the end of the days, it's even worse, because it's using loads of energy. It's why it can kind of almost feel a bit neurally fatiguing, so feeling like kind of you've got a bit of kind of almost brain fog and almost kind of feel a little bit out of it, really, because of your body's just using so much energy to keep it tight. Cool. So the age-related disc changes. So these generally, if you've got something that's a problematic disc change, will feel like a real intense pain in the centre of your spine. So it'll be very specific, and when I say where do you feel it, you'll be able to say feel it there, and it's really, really specific, and it will feel like someone's kind of put an electric shock into you, or someone shot you in that specific point. It's a very, very specific place. It is quite rare, but everyone thinks they've got it, but you would know if you get it, because it is absolutely horrible, and it does feel like a gunshot in your back in certain movements. Normally, when you first get something like that, it will be from a specific movement, so it normally is an episode and you know how to do it. So it will be normally leaning into a certain position, normally going backwards and to a particular direction, and it feels very horrible and very specific. Right. Any questions about different types of back pains with pathologies, and any ones that I've missed that you want me to talk about? Cool. So, what do we do about back pain? So the most important thing that I'm sure everyone is here for is, what do we do about back pain? The important thing is with any ache or pains that you do something. Generally nothing goes away on its own, and if you think it's gone away on its own, you probably forgot what you did to let it settle down. So with anything, it's just not going to settle on its own. Doesn't mean you need to see someone for anything and everything and become a hypochondriac. That's impossible. And by the time you've actually walked out the door, it's fixed itself. But the walking out of the door is fixed. So nothing kind of cures itself on its own. You just need to know what to do and when. So the first thing that I think is key is, as I said before, is moving. The old-fashioned saying of rice is one of the most outdated kind of first aid, physical kind of health things. It is absolutely useless for, I would probably say 95% of issues. We don't want to ever completely rest. So the one that I use is police. So it's protect, optimal loading, and then ice compression elevation. So the protect and optimal loading is the key to anything. So with our back, we're protecting it by not doing the thing that we just hurt it doing. So if we've hurt it by bending over in a certain position, or lifting something that we shouldn't do, or I don't know, doing something silly, then we stop that. So the protect is quite an easy one to do. The optimal loading is where most people just skip, but it is the most important thing you'll ever do with any type of injury, but specifically back pain. We've got to optimally load, which basically just means move. With any of these, you're going to get stiffness, you're going to get pain, and the more you stay still, the more stiffness, the more things are going to start to knit together and start to heal itself. And then when we go and try to move, it's going to be more painful. So it might feel good at the time, it might feel, great, I'm going to go lay in bed, and actually it feels brilliant. Nice supported kind of mattress, and it feels really, really good. But then as soon as you try and turn over, suddenly you need the loo, and it's kind of, I'm in trouble here. I can't roll over to get out of bed. And that's because you've used something to support yourself. So you've used your bed to support yourself, and you've just used it for too long, and then suddenly everything's stiffened up, and you're in trouble. So what we need to do is optimally load, which is moving. In reality, it doesn't really matter what that movement looks like. If it's a really sharp, horrible muscle spasm, any movement is going to be helpful in this. Small little movements, kind of even laying on your side and breathing, that you can view. If you get good at controlling your diaphragm and controlling your breathing, you can actually kind of breathe through your lower diaphragm and move some of your lower back, which is really helpful. But any movement is really, really important. If we don't move, what happens is everything just heals and it sticks together. If it sticks together, every time we move, we just break and we get stuck in this cycle, and it feels pretty horrible. Does that make sense with optimal load? Perfect. And then probably the most common question we get asked, I think, in clinic is ice or heat. Who prefers ice?
I use both.
Who prefers heat? Who prefers both? In reality, it does depend a little bit on what the kind of injury does, but it's really is from the latest research that keeps coming out. It keeps changing. So one year we'll say we've been told to use ice, the next year we're told to use heat. In reality, that they're starting to look at, it doesn't really matter. As long as you're changing the temperature of those tissues, it's going to start to bring chemicals to that is going to start to heal things. Especially with back pain, we don't tend to get lots of swelling and inflammation in our back when it goes, so it doesn't really matter. It makes more of a difference in joints like our knees. If our knee goes and we get huge swelling, bruising, we don't really want to use heat because we don't want any more blood flowing to it. With our backs, we don't get that same inflammatory response. So in reality, it doesn't really matter. I personally prefer heat, just because I'm a bit soft and I don't like the cold. So for me, heat just feels nicer, but it doesn't really matter. If you want to use ice, you can use ice. If you want to use heat, you can use heat. If you want to use both, fine. But as long as you're doing one of them, then it doesn't really matter. They both use different physiological responses to get blood and healing chemicals to it. But as I say, I prefer heat because it just feels a bit nicer, and I can sit in a nice hot bath rather than sit with a bag of peas on my back. Painkillers. Again, everything's got their place in medicine. I'm not going to spend too much time on painkillers because it opens its doors up to a lot of controversy and a lot of specifics. But painkillers definitely have their place, but it's got to be used in the right way for the right problem. Generally, most back pain, in the first instance, doesn't need a huge amount of painkillers. If it's longer term or if it's neural, it might be a different story. But if you get the first bits right, protecting it and optimally loading it, and then coming up with a rehab plan to get it sorted, you don't need a huge amount of painkillers. If it's something that you've left for a long time, and it starts to become chronic, or you've started to get really bad neural issues that need to be controlled, we need to control the symptoms, then painkillers are helpful. What I don't like with painkillers is using them to get through something. So they've got its place in certain situations. The bit that it sort of never has its place is to get through something. So we don't ever want to take it to get through a run or get through a gym session, get through kind of an activity. If we want to get through sleep, happy days, there's only so much you can do sleep unless you sleep run or sleep box or something bizarre. Then you don't really worry about sleeping. But we never want to take them to mask it, to go through it. We need to know what it feels like. And if we know what it feels like, then we can alter what that's going to be from a movement point of view. So if we know it's sore, when you come in the gym and you say it's sore when I do this, then it means that we can control it and we can kind of create exercises and get our brains going of what you can do that either helps to get it moving or just doesn't include it at all. So we don't want to ever take painkillers to get through something, if that makes sense. The other thing that people get wrong is exercise. As I said, I worked in professional rugby for a long time. In my time there was only kind of probably 2 players that were injured, that 2 kind of issues that we let them miss a gym session. And we used to deal with some horrible injuries and some really, really nasty back injuries. But there was always something that's going to help them in a gym. So the 2 injuries, one is concussion, which is relatively obvious, and the other one is any heart issues. Again, they're just well above my pay grade to be able to do it, and we had to have signed off from other people. But any aches and pains, there is always something you can do in the gym, and probably 90% of the time people walk out of the gym thinking, actually, I'm glad I came. Didn't want to come, I wasn't going to come, everyone told me at home I shouldn't come, but I've walked out and it feels great. So there's always something you can do. It might give the coaches a little bit of a headache to get their brains thinking of what exercise can you do, but there's always something, and I'm sure that they quite like it at some points to get their heads thinking. It gets some of their new exercises and their creative brains going. So there's always something that you'll be able to do in the gym, even if your backs are in horrible spasms. Your arms still work, your hands still work. Just getting the blood flowing somewhere else through the body will relate to your backs. That's the same with other kind of issues. If you've got a dodgy shoulder, if you've hurt your arm, you've just got another one. You've got your legs. There's always something you can do. If you've hurt everything, then that's a little bit tricky, but I'm sure there's something that they can find. But there's always something you can do in the gym, and just getting the blood flowing through something else gets all of our endorphins, gets our dopamine going, all the fun chemicals go around our body, as well as all the healing chemicals. So there's always something you can do. It's important that you let people know what the problems are, what you've hurt, what it feels sore, so they know. But there's always something that you can do. That's something that I'm really big on.
Can I ask you, some of those muscles in your lower back can be really strong.
Mm.
And if you've got them going all the way across your lower back and you can't walk because you can't move your legs, would you still be recommending that you come in and try and do something there?
Yeah, if you can get here safely, then absolutely. If you can't walk and you normally walk to the gym, it's a little bit tricky. But if you can get in, then absolutely. Yeah, because there's always stuff you can. If you can't walk very well, if it's really painful to walk, some of the most comfortable positions are in that kind of, not doing a glute bridge, but on your back with your legs up slightly, or laying on your side in a kind of almost fetal position. When you're in those positions, a lot of the pains go away because it reduces some of the pressure on it. And in those positions, there's loads of bits that you can do with your upper body. There's some real basic kind of core and pelvic floory type exercises you can do. So yes, absolutely. As long as you can get to the gym, there'll always be something to do. Those are the ones that will get the coaches thinking a little bit more. But there is always something that you can do.
No doing it.
Absolutely.
They are doing it. They've been supporting me because I've had the pain down my leg, but I've still been coming in and they've been doing upper body and core strength.
Fantastic. And that's a great example because there's always something you can do. And when you go out there, even though you might not have done anything with this, because you've done stuff with your arm, it's got everything going, it's got your endorphins flowing, it's got the healing chemicals, and it's helping everything further down. So there is always stuff you can do, as long as you can get to places safely, there'll always be something you can do.
Is it, when you're like having a dream at the gym, there's a certain point where it's like, it can be painful, but if it's painful, do you stop? Or is it like sometimes it's painful, but it's okay?
So the general rule is if something's a sharp pain, then stop, or change it. So if it's being caused by you're lifting too heavy, the first thing is always try and do it lighter, or it's looking at the technique. Am I doing something quite kind of strange? Am I not doing it right? So you get one of the coaches to, this is a bit of a sharp pain. Can you have a look? Am I doing it right? If it's still a sharp pain, then stop and do something different. If it's something that's a little bit more of a dull, kind of toothache type feeling, if it feels like it's in a muscle, then generally it's okay to carry on if it's a 2 or 3 out of 10 feeling. If it goes to kind of 4 or 5 and it keeps progressing, then that's when you stop. That's kind of the general rule of it, but it does depend on the kind of bit more specifics of what's going on. But yeah, just because you feel that way, don't stop. It can sometimes be kind of tricky to know what the feeling is, but you generally don't get much problematic issues if it's just a 2, 3 out of 10 ache. But it's worth getting the technique checked if anything feels different. And if you get it on both sides, then it's probably because that muscle's weak rather than because there's any issues. We should be feeling something when we're training in the gym. So it's just getting that awareness of your body of, does this feel like when kind of I do a really kind of heavy deadlift and it feels quite uncomfortable, or does it feel like when I trap my finger in a door? And it sounds silly, but when you're kind of in the middle of a gym session and everything's going and music's going loud and everyone's motivated, it can be quite hard to ask yourself those questions. So anything sharp, general rule is stop. Does that make sense?
Yeah.
Cool. So has anyone got any questions? Anyone got any kind of specific back pain issues, back problems, or any questions on anything that I...
Can I ask you a difference between, so when do you move from the acute phase into the chronic phase, and the difference in how you would tackle those two aspects of it?
So the acute phase is when you've had a problem. So it's generally either something's gone into a spasm or you've had a sharp pain. Normally that can come down to you can tell when that phase has happened. So you if I said what's happened, you'd be able to say bend down and did this, or I twisted or I did this. What we can happen that gets a bit confusing is get multiple acute phases. So if we don't do it right and we don't strengthen the right things, then we can it starts to improve and then it comes back again. And that, even though that can go on for years, that's still classed as acute, because it's a new kind of issue happening each time. The chronic is when it's more something that it can still be very, very painful, but the same thing is happening day in, day out. We're not getting these big ups and downs. The acute issues are generally easier to fix because they're easier to find cause. When we see something quickly, so the sooner we can see something, the sooner we can fix it. The chronic ones that may have started as that have then been left, and now suddenly you feel them every day, those are the harder ones to deal with, because some of those you might have felt it for years, and that it's just been busy lives, busy families, busy whatevers, and we've just not got them got round to it, and now suddenly we want to do something and it doesn't let us do. So those are the ones that we class as chronic, and they're generally more tricky to get to the bottom of, and then take a little bit longer to solve. A lot of the kind of treatment advice and kind of plans, they're quite similar from acute to chronic. It's normally the speed that is really the difference. Sometimes we have some sort of slight chemical differences with inflammation. If we have chronic nerve issues, they are the longest thing to recover. If we cut a nerve, the nerve heals slower than a human hair takes to grow. So nerves heal incredibly slowly. So the more damage you've done to a nerve, the longer it takes to fix. You can fix nerves, but it just takes longer. Does that make sense?
Yes.
Any other questions from anyone?
Do you ever have a go of muscle relaxant?
Say that again, sorry?
Would you ever use a muscle relaxant if someone's got muscle spasms?
Yes. The short answer is yeah, it has to be quite specific. So if it's just a first time acute muscle spasm, then absolutely not. But if your body's got really far down that route of it, goes into muscle spasms, when it really has no need to protect it, when it's not trying to protect it, you're just kind of getting out of the car and it's going into these muscle spasms, or you're brushing your teeth or things like that, then yeah, absolutely. Those are the ones that you do have to manage quite well, because if you're ingesting muscle relaxants, then your kind of your chemical system doesn't know where to send it to. It just relaxes all of your muscles. So then if you try and train on kind of whilst you're on those, you just need to be aware of it. You don't go as hard, you don't go as kind of dynamic when you're using muscle relaxants, because we need to be aware that we just don't have that stiffness, and we have a little bit of a delayed kind of new response to the tendons. So yes, it's got its place, but more for the chronic muscle spasms.
When you say a nerve can take a long time to heal, roughly what do you mean by long?
It really depends on what the problem with the nerve is. So if the nerve has been damaged, then there's kind of, it depends on the kind of length of that damage. A lot of nerve problems don't actually come from nerve damage, they just come from the nerve being pinched. So if the nerve's pinched and it's not caused any nerve damage, as soon as we untrap it, so again using the hose, if we kink a hose, as soon as we unkink it, it's fine, it's back to normal. And that's what will happen to a nerve if there's no nerve damage, it's just being compressed somewhere. So that could be coming out of the spine, it could be coming through the pelvis, it could be even underneath the hamstrings, they're really tight and clamping around them. So if it's just that, releasing that, happy days, you're back to normal very, very, very quickly. If it's been there for a long time and the nerve is actually damaged, then it is kind of how long is a piece of string, because it does depend on what that nerve is damage is like. But the first thing is getting rid of where it's been irritated. Because if we just deal with the nerve symptoms, we're just going to go round in circles and circles. So the first thing is reducing where it's been pinched or trapped, or working out where the damage is, and then we can yeah, so it is kind of how long is a piece of string, really.
So do you find that through massage and things like that? Or how do you find where these?
Yeah, so it's not necessarily massage, because if we look at this, if we look at where these kind of nerves are, we can't press on those. So this is probably the height of my spine, probably, a little bit shorter, but it's not far off. So if we tried to push through here, we've probably got 2 inches worth of muscle and other soft tissues. So we can't push on these. So we can't actually feel for the nerve, probably. So if anyone kind of presses on your back and says, oh, I can feel your nerve, absolute rubbish. We just can't. There's too much soft tissues going through it. What we can do is replicate certain movements. So we know where the nerves go and we know what they do. So what we can do is we do it through various movements. So if we thought this nerve here was being pinched, we know how to move the spine to do that. So we'll do various tests of getting you moving or moving yourself to either pinch that nerve to see if that's what's causing symptoms, or the other way, to release it and see if it reduces. And that's the same further down. So if we think it's the muscle, we can contract that muscle, and if that reproduces the symptoms, we know it's being pinched there, or the other way, it reduces that. So it's more the assessment way than it is massage. The massage and the soft tissue kind of treatments are more to get rid of it. So if we thought it was being pinched or there was an element of muscle spasm involved, then that's where the massage side of stuff comes in to fix it rather than to assess it. That makes sense?
Yeah, so carrying on from that, how do you if I can't diagnose by what you've said this evening, when do you go to you? When do you go to you?
So
find out,
yeah.
find out that it's really long.
Yeah. 2 o'clock tomorrow. So it's a bit of a tricky one because I don't like people to be hypochondriacs because it's not a healthy bit to every time you feel some ache or pain to go and get it solved, because as I said, most of the time it was solved by then. So it is a tricky kind of thing to know where to go. My general rule is if it's stopping you doing something for more than a week or two, then you should get it looked at. If it's improving, then carry on that path, and when it starts to plateau, and it plateaus for a week or two, then that's when you need to see someone. But it is a bit of a tricky one to answer. The quicker that we can see something. So if there's been a mechanism, so if you've lifted something and something's gone, kind of either felt like it's gone pin, or you've had that sharp stabbing pain or something like that, you know something's gone wrong. So you don't need to wait. So going to see someone straight away is helpful. If it's more of the kind of dull, achy, toothache bits, that's when I would leave it a couple of weeks to see if it's improving with movement and with exercise. And if then it's still not, then that's when you should see someone.
I'm sorry, I'm asking another question.
That's all right. That's what I'm here for.
What's the difference then, what's the difference between what you do and what, say, a chiropractor or osteo, or what is it? Joints? Is it muscles? Is it?
So we do a bit of everything.
Right.
So chiropractors, and the tricky bit with any medical profession is that you come out of university all with completely different skill sets, but we all go on the same CPD courses. So some of my kind of acupuncture or whatever courses that I've been on, there'll be chiropractors, there'll be massage therapists, osteopaths, all sorts of different therapists that you've never heard of. And over the years, a lot of kind of emerge into very similar ones. Generally, chiropractors, when they first come out of university, their job is to realign things. So what they do is what we call high velocity thrusts, which is the kind of clicks to then get things back in line. That's the main thing that they're taught from a back point. They just put everything straight, but they're generally not taught how the soft tissues work. So if it's then being pulled out by a muscular issue, or by a movement pattern, or by a kind of a worn down joint surface, or something like that, then it's just going to go back into it. So it can generally feel good, and then start to ease back. Osteopaths are very, very similar, but they do a little bit more down the kind of medical route. They kind of learn a bit more about about medication, drugs, and cardiac issues and cranial stuff. So they're similar, but a little bit more medicalised. We basically deal with muscles, joints, and connective tissues, really. So we kind of are a little bit of everything. So we don't do any time kind of learning about the respiratory system, and not a huge amount of cardiac problems. All of our training is around the muscles, joints, nerves, and how they all interact with each other. So the team that we've got are all kind of slightly different backgrounds that have different specialities. So we've some people that do acupuncture and cupping and manipulations, sports medicine, various different things. So we've all kind of targeted slightly different routes, if that makes sense. So it is a bit of a minefield of who you should see for anything. But I would always say the best thing is just give us a call and we'll direct you. So what we'll never do at my place especially is that we'll never tell you to come in if it's not something we can fix. Because what's the point of us trying to do something we know we can't do? So we're very good at just, if that's not an issue that we can sort, or we think actually you're gonna come in and actually you need to go and get an X-ray because you just dropped a dumbbell on your foot and it's all swollen and kind of thick, and right, we'll just say this is where you should go for this, or if we don't have someone that we can refer on to, then we'll just say this is the type of professional that you need to. But don't let the kind of paralysis of the professional to stop you doing something. As I said, that's a lot of people end up doing that. Don't know who to see. Someone's recommended me a chiro, someone's recommended me a massage therapist, someone's recommended me some bloke that lives in his garage, and it's like, who do I go and see? And then you put on Facebook, who should I go and see for my back pain, and you get 4,000 people have recommended different things. So it's all very overwhelming. So I would always say just phone someone and ask them. I'm always going to be biased because I think I've got an absolutely fantastic team. So we'll always be honest, if we can't help you, we'll try and send you in the right direction. But yeah, don't let that kind of paralysis of different professionals stop you from doing it.
What is your training? What did you, when you studied?
So I did sports therapy, so I didn't want to go into the NHS, so I was always very single track minded. I was on the brink of being a professional rugby player, and I wanted to stay within professional sport. So when everything got injured, it was the options for me were kind of go down the traditional kind of route, but then going through the NHS system and working through that. And I looked into it quite a lot, and I just didn't want to do that, especially at that age. Sport was my life and still is to an extent. So I wanted to go into sport, and that was the best route that I could take. So I did 3 years of training on kind of MSK issues, so musculoskeletal, so joints, nerves, muscles, to then train. And every kind of CPD course from there was been geared up to follow on from that, really. You will see a lot of changes in different professions, I think, in the next few years, because there's a lot more coming out, and especially the NHS funded courses have changed quite a lot. They no longer treat, they no longer teach manual therapies and manual treatment, so actually touching patients from a treatment point of view on their NHS courses, which I think is wrong. It's a whole other kind of rant that I could go on for hours, but it's that you're going to get some more different names of qualifications coming out over the next few years from that. So don't worry about the kind of type of people. The thing that we always look for when someone phones up is kind of, what is your problem? And then we'll work out who the best person to see that problem is. And ultimately, you won't probably know what that person's qualification is. You'll just know that person's fixed hundreds of those problems, and ultimately that's what the problem is. And I've never asked my mechanic to see his certificate or what his kind of thing is. All I know is he fixed my mum and dad's car for years, so I take my car there. So ultimately, if someone's fixed hundreds of people's backs and my back hurts, that's what I'm going to. But it is an absolute minefield of things. And we don't deal with any insurance companies, so we don't deal with boopers or actors or anything like that for that exact reason. We want to be in control of how many times you come to see us, what we need, what we can do. So we're completely independent, which gives us the freedom of doing what everyone needs, not what AXA says you're allowed 3 sessions and then you gotta go. That make sense?
Yeah.
Perfect.
You start to sit for an extended period of time, you're starting to get back pain. Obviously that's causing compression on your spine. what kind of movements can you do just to kind of, before it gets to a worse stage, what kind of movements can you do just to free up your back and free up some
So depends what you've been doing to be still for a long period of time and what you've got access to. So any movement is important. So if you've been sat at desk, just getting up and standing up is going to be better than staying sat down. If you've got the ability to actually move and your time isn't limited or space isn't limited, the best kind of movements are walking and squats. So walking is great to just get general blood flow moving. It gets everything kind of twisting, it moves everything in all the directions that it wants to move. The important thing when you walk, actually walk upright. It sounds stupid, but don't walk in on your phone or looking at your feet. Or walking upright is so important, because if you are stiff anywhere, then walking kind of hunched over is just going to make it worse. And I've done that myself. I used to go for a walk thinking I'd been really healthy at lunchtime and be on my phone doing my emails and wondered why my back was hurting, and it took someone else to tell me that, well, when you're walking like this for an hour and a half. And it sounded absolutely stupid when someone told me, but I was doing my emails to patients at the time when someone told me that. So it's quite a simple thing, but walking upright is really, really key. And then squats, it's one of the kind of the best movements to get so many muscle groups working. Doesn't have to be squatting for weight, it's just body weight squats. Even sit to stands from a chair, 5 or 6 of those. Don't need to be getting your heart rate up, we're just getting things moving, just getting things, blood flow going is enough to get things moving. If you've been still from a seated position, like in all the chairs that you guys have got, what you'll find is your hips are going to get really, really tight. So anyone that sits either on the sofa or on a desk, your hips are going to be really, really tight. So the best thing, once you've got up and got moving and a little bit warmer, is just stretching your hip flexors. I'm lazy, so the way that I do it is put my foot up on something. Doesn't matter how high, that's a bit too high for this. So put your foot up on something and then squeeze your bum, and you'll feel a pressure in the front of your hips. I always just do this when I'm doing something. So if anyone ever phones me, I'm probably doing this whilst I'm on the phone. It's just an easy thing you can do. You can do it on a chair, an arm of a sofa. Doesn't really matter, but you can do it anyway. So as long as you don't have to take notes on a phone call, then why not stretch? But if you've been sat down, our body just ends up being into this position, and as soon as you stand up, you'll then have that arch in your back. So stretching those hip flexors is so important that you can be sat down for long periods of time. So everyone, when they get home,
Further to that, for driving, I do quite a lot of long distance driving and get quite a lot of sort of shoulder pain. What's the best thing? Because you can't just keep jumping out the car and running down the side.
Yeah. So from a kind of shoulders and upper body, so when you're looking at anything for long periods of time, you basically do the opposite of what you put your body into. So most things, driving and sat at desks are very similar things. So it's hip flexors are going to be tight and our shoulders are going to be rounded forward. So the best things to do is that stretch and stretching out our pec. So in the door frames, on the racks, kind of into that position to open up our shoulders. When you're actually driving, having that posture in your car in your seated position is really, really important. Because if you are really sat forward and your shoulders are coming forward, then you're already kind of set into a bad position. If that's then going on for hours and hours, then no matter how much stretching you're going to do, it's not going to do much. So it's having those shoulders back and in a sort of, not in a over-exaggerated posture, but it's just in a relaxed, neutral posture. So setting up your car right is really, really important. And enough to stop in a bit of fidgeting around, so don't have to be sat completely still when you're doing anything. A bit of fidgeting does help. So yeah, posture, and then just looking at where things are. So if you drive and you always have your arm on the windowsill, then that's the arm that you're going to focus on stretching, because that's going to be there for longer. Does that make sense? But yes, it's a tricky one because it's not a good position for our bodies to be in, but it's not something that we can overly help. So when you do get out, it's lots of stretching and holding the stretches for a good couple of minutes. The longer you hold the stretch, the better. There's no in reality, there's no upper limit of how long you can hold a stretch for pretty much any stretch. So if you've been sat for 3 hours in a seated position, there's nothing wrong with you being comfortable in that position and holding it for 5 minutes. The longer we hold the stretches, the better. That's why I like putting it up on something, because the traditional football stretch of holding that, one, I'll get bored, and two, I haven't got very good balance, so I'll probably have something else falling over. So I can quite happily put that there on hours and talk on the phone and do that. So make it easy for yourself, and then you'll hold those stretches. Any other questions about anything? Any specifics? Any non-specifics? Cool, awesome, cool. Well, we will stop it there. So,
with strength and spirit seize the day. Where there's a will, there's a way. Feeling pain-free, active and free. A healthy future for you and me. Where there's a will, there's a way.